Behcet's disease in the brain causes, symptoms, and risks. Behcet's disease is an autoimmune disorder, meaning the body's immune system attacks its own healthy cells. This can affect multiple organs, including the brain, eyes, skin, joints, and blood vessels. When it affects the brain, it's called neuro-Behcet and can lead to symptoms like headache, fever. 1. Causes of Behcet's disease. The exact cause of Behcet's disease remains unknown, but it's believed to be a result of an interplay between genetic and environmental factors. Genetic factors. Certain genes have been linked to Behcet's disease, suggesting a strong genetic predisposition. 1. Causes of Behcet's disease. Environmental factors. Researchers suspect that a virus or bacteria might trigger Behcet's disease in those who are genetically susceptible. However, specific triggers haven't been conclusively identified. 2. Symptoms of neuro-Behcet's. Neuro-Behcet's can cause a range of symptoms, including headache. This is the most common symptom. It's typically severe and can last for hours or days. Fever. Fever is a sign that the body is fighting an infection or inflammation. It can occur alongside headache or independently. 2. Symptoms of neuro-Behcet's. Disorientation. Individuals might experience dizziness, confusion, or difficulty navigating their surroundings. Loss of balance. They may struggle to maintain balance and be prone to falls. Stroke. In severe cases, neuro-Behcet's can lead to stroke due to blockage of blood vessels in the brain. 3. Risk factors for Behcet's disease. Certain factors can increase the risk of developing Behcet's disease. Age. Behcet's typically appears between the ages of 20 and 30, although it can affect children and older adults. 3. Risk factors for Behcet's disease. Geographic location. Individuals from countries in the Middle East and East Asia, including Turkey, Iran, Japan, and China, have a higher prevalence of Behcet's disease compared to other regions. Gender. While Behcet's affects both men and women, men tend to have a slightly higher risk. 4. Diagnosing neuro-Behcet's. Diagnosing neuro-Behcet's can be challenging as the symptoms overlap with other conditions. Doctors will use several factors to make a diagnosis. Medical history. The doctor will ask about the patient's symptoms, including their onset, severity, and any associated factors. 4. Diagnosing neuro-Behcet's. Physical examination. The doctor will assess the patient's overall health, including neurological examination. Blood tests. Blood tests can detect signs of inflammation or autoimmune activity. Magnetic resonance imaging. MRI. MRI helps doctors visualize the brain structure and identify any lesions. 4. Diagnosing neuro-Behcet's. Cerebral angiography. This imaging technique allows doctors to check the blood vessels in the brain for any blockages. 5. Treatment for neuro-Behcet's. Treatment for neuro-Behcet's focuses on controlling symptoms and preventing brain damage. Treatment options include nonsteroidal anti-inflammatory drugs. NSAIDs. NSAIDs help reduce pain and inflammation. 5. Treatment for neuro-Behcet's. Immunosuppressants. These medications suppress the immune system's activity, thereby reducing inflammation. Antibiotics. Antibiotics may be used to treat infections associated with Behcet's disease. Physical therapy. Physical therapy can help improve muscle flexibility and strength. 5. Treatment for neuro-Behcet's. Psychological therapy. Psychological therapy can help patients cope with the symptoms and challenges of living with Behcet's. 6. Important notes. Neuro-Behcet's is a serious condition, but with appropriate treatment, individuals can manage their symptoms and maintain a good quality of life. Regular follow-up with a doctor is essential to monitor the condition and adjust treatment plans as needed. 6. Important notes. Remember, the information provided here is intended for general knowledge and should not replace professional medical advice. If you have any concerns about Behcet's disease or its symptoms, please consult with a qualified healthcare professional.